Hey everyone, and welcome to the Deep Dive. I'm Harvey.
And I'm Donna.
And we're both MCCQE reviewers.
Yeah, we're kicking off a series of deep dives.
To help you feel more comfortable with the exam review process.
That's right.
We'll be breaking down
all those
major concepts, the exam covers.
Yeah.
And we're going to be using reliable sources.
Like stat pearls to guide us.
Absolutely.
And before we jump in,
standard disclaimer.
This is not medical advice.
You got it.
Always consult a qualified healthcare provider.
Yes, safety first.
For any health concerns.
All right, let's dive into our first topic.
Pneumoconiosis.
Pneumoconiosis.
It might sound like a mouthful.
Yeah.
But it's a group of lung diseases.
Really important to understand.
Both for the exam.
For your future practice.
It's fascinating because it's all about the environment impacting health.
Yeah.
Specifically inhaling certain types of dust and fibers.
Often in the workplace.
Yeah,
like the air you breathe can literally leave scars on your lungs.
Yeah.
And our sources highlight 3 of the most common types.
Asbestosis.
Silicosis. And co-workers pneumoconiosis.
Which is often called.
Or black lung disease.
Black lung disease.
And they all share a common thread.
What's that?
Those tiny inhaled particles trigger inflammation.
Okay.
And over time, that inflammation leads to fibrosis.
Fibrosis.
Which is essentially scarring.
Scarring.
Of the lung tissue.
And the scary part is this damage is
irreversible.
Irreversible.
The stat pearls data really brings home how serious this is.
Yeah.
Between 1990 and 2017, there was a staggering 1% increase.
Wow.
In pneumoconiosis cases.
And it's not just numbers on a page.
No, it impacts real people.
Yeah, with men and older individuals being particularly vulnerable.
Yeah, globally, it's a significant cause of death.
Which is why we need to understand these diseases inside and out.
Yeah, early detection.
Prevention.
And proper management.
Can make a huge difference.
Absolutely.
Okay, let's zoom in on asbestosis.
Our stat pearls source describes it as
a chronic progressive lung disease
caused by inhaling asbestos fibers.
Asbestos was once a popular material in industries.
Like
construction,
shipping,
and even aerospace.
Wow.
It was strong,
durable,
and heat resistant.
So it was useful.
Unfortunately, those same properties that made it so useful also made it incredibly dangerous when those fibers become airborne.
They get inhaled.
Right.
So it's like a double-edged sword.
Yeah. Strong and useful in one sense, but potentially deadly in another.
Exactly. And once those fibers get lodged in the lungs,
they trigger an inflammatory response.
Yeah.
Leading to scarring. Symptoms like shortness of breath. Persistent coughing.
And even
chest pain.
Chest pain can develop.
Over time.
Over time is a slow burn.
But the damage is real. Our source emphasizes the importance of taking a detailed occupational history.
To diagnose asbestosis.
Yes.
It makes you realize that just asking about someone's work can be a critical diagnostic tool.
Absolutely. Sometimes the clues to a diagnosis are hidden in plain sight.
Yeah.
Along with a thorough occupational history, imaging, and lung function tests also play a vital role in diagnosis.
Our source mentions that there are 3 main ways people get exposed to asbestos.
Direct occupational exposure.
Bystander exposure.
General community exposure.
So it's not just the people directly working with asbestos who are at risk.
Right. Think about electricians. Or painters who might be working in a building with asbestos even if they're not handling it directly.
That's bystander exposure.
And then there's general community exposure.
Which can happen if
asbestos is present in things like
old building materials or even road surfaces.
Yeah.
So it's a risk that can be lurking in unexpected places.
And here's where it gets even more interesting.
Okay.
The severity of asbestosis is directly tied to the amount of exposure someone has had.
So direct occupational contact
carries the highest risk.
Makes sense.
As you might imagine.
Yeah, the more you're exposed, the greater the potential for damage.
Our source points to a study in Japan that found the highest incidence of asbestosis in people working as asbestos board installers. And sprayers.
It's a stark reminder that this is a global issue.
And that certain professions carry a much higher risk.
Okay, let's take a peek under the microscope.
Okay.
And talk about how asbestosis actually develops at the cellular level.
The pathophysiology.
The pathophysiology.
Imagine those microscopic asbestos fibers entering the lungs.
Okay.
They irritate the delicate lung tissue and trigger an inflammatory response.
Okay, so the body's first line of defense kicking into action.
Macrophages.
Macrophages.
Which are like the cleanup crew of your immune system, rush to the scene.
To try and engulf those foreign invaders. Right.
But here's the catch.
Asbestos fibers are incredibly tough.
So those macrophages struggle to break them down.
It's like trying to digest shards of glass.
Oh, wow.
And the more those macrophages struggle, the more inflammatory signals they release.
Calling in reinforcements like...
The
fibroblasts.
Like fibroblasts.
Fibroblasts, those are the cells that produce collagen.
And help with wound healing, right?
Right. But in this case, instead of neatly repairing the damage, they end up laying down too much collagen.
Leading to fibrosis.
That stiff scarred tissue in the lungs.
Exactly.
So it's like the body's own repair mechanism backfiring.
Exactly. And to make matters worse, this whole process generates reactive oxygen species.
Reactive oxygen species.
Which are like tiny wrecking balls.
That cause further damage to lung cells.
It's a vicious cycle of inflammation and scarring.
That ultimately leads to the breathing difficulties and other complications associated with asbestosis.
It's like a domino effect of destruction.
That's a great way to put it. And it highlights why preventing exposure to asbestos in the first place is absolutely crucial.
Okay, let's shift gears and talk about another type of pneumoconiosis.
Silicosis.
Silicosis.
Our source tells us it's caused by inhaling something called respirable crystalline silica.
RCS.
Ah.
And you might be surprised to learn that silica is actually one of the most abundant minerals on Earth.
It's found in tons of rocks and stones.
So it's not some rare exotic substance. It's literally everywhere.
Pretty much.
But it's the size of the silica particles that matters.
Right. RCS particles are tiny enough to bypass our body's natural defenses.
And reach the deepest parts of the lungs.
Triggering that same cascade of inflammation and fibrosis we talked about with asbestosis.
So even though silica is common when it gets into the lungs in a certain form,
it can wreak havoc.
Exactly. And just like asbestosis, silicosis is preventable.
But incurable.
Our source stresses that it's a major global health concern.
Affecting workers in diverse industries.
Like
mining construction.
And
even manufacturing.
Manufacturing, it also carries a high risk of serious complications.
Oh, like lung cancer and tuberculosis.
Okay, so we know it's serious. But how do we even know if someone has silicosis?
That's where a good detective comes in.
Or in this case, a good doctor.
A detailed occupational history is key, just like with asbestosis.
So asking the right questions about someone's work history is essential.
Absolutely. In addition to that, imaging studies like
chest x-rays
and HRCT scans
play a vital role in diagnosis.
And our source mentions that there are actually 3 main forms of silicosis.
Acute.
Accelerated.
Chronic silicosis, the most common form.
Takes
years, even decades to develop.
Usually after prolonged exposure to lower levels of RCS.
Acute silicosis is the rarest and most severe form.
Usually occurring after
a short,
but very intense exposure to RCS.
Think about sandblasting without proper protection.
Then there's accelerated silicosis,
which develops over a few years. And finally, chronic silicosis. The most common form takes years, even decades to develop, usually after prolonged exposure to lower levels of RCS.
Right.
So it's not always a quick onset. Someone could be exposed for years before they even realize there's a problem.
That's why it's so important to be vigilant about prevention measures.
And to take any respiratory symptoms seriously.
Especially in people with a history of silica exposure.
Okay, let's move on to the third type of pneumoconiosis on our list.
Coal-workers' pneumoconiosis.
CWP.
You'll probably hear it called black lung disease more often.
And it's exactly what it sounds like, a lung disease caused by inhaling coal dust.
And those tiny coal dust particles accumulate in the lungs.
Leading to,
you guessed it,
inflammation and fibrosis. It's like a recurring theme with these pneumoconiosis diseases.
It's touching on
one of the telltale signs of CWP is something called
melanoptisis. Which is just a fancy way of saying that the person coughs up black pigmented sputum.
It's a pretty stark visual reminder of what's happening inside the lungs.
Our source mentions that chest x-rays and CT scans are essential for diagnosing CWP.
They'll often show
small, rounded opacities.
Primarily in the upper parts of the lungs.
And something interesting to note.
What's that?
MRI can actually help differentiate CWP from lung cancer.
Which is important
It
because
is important because both conditions can present with similar symptoms.
early detection and accurate diagnosis are crucial for getting people the right treatment.
Absolutely.
So we've covered 3 types of pneumoconiosis.
And it's clear that these are serious conditions with lasting impacts.
No magic cures there.
Unfortunately, there's no magic cure for pneumoconiosis.
The damage to the lungs is irreversible.
But that doesn't mean we give up.
Right.
Early detection and management can slow the disease progression and significantly improve someone's quality of life.
So that's where the focus shifts to supportive care, right?
Exactly.
Helping people manage their symptoms and live as comfortably as possible.
Supportive care is a big part of managing pneumoconiosis.
Like what?
Oxygen therapy can help with breathing difficulties.
Okay.
And vaccinations can protect against respiratory infections.
Which can be particularly dangerous for people with compromised lung function.
Right. It's all about giving them the tools to breathe easier.
And stay as healthy as possible.
There's also pulmonary rehabilitation.
Pulmonary rehabilitation.
Which involves a combination of exercise education and breathing techniques to improve lung function and overall well-being.
It can make a real difference
in someone's ability to stay active and participate in daily life.
So it sounds like a holistic approach, addressing both the physical and emotional challenges of living with pneumoconiosis.
That's the goal.
And in some cases,
But
especially with end-stage disease, a lung transplant might be an option.
that's a major decision with its own set of risks and benefits.
And it's not suitable for everyone.
Right.
It's a last resort.
It's a possibility for some patients.
Yeah.
The key takeaway here is that there's a whole spectrum of care options.
Depending on the individual and the severity of their condition.
Exactly.
It's about finding the right approach for each patient.
A personalized care plan.
You got it. And as future physicians, you'll play a vital role in not only diagnosing and managing these conditions,
but also in preventing them in the first place.
That brings us to a really important point.
Prevention.
Prevention.
It's always better to prevent a disease than to treat it.
Absolutely.
Yeah.
What are some of the key strategies for preventing pneumoconiosis?
Prevention is multifaceted.
Okay.
First and foremost, it's about minimizing exposure
To those.
to those harmful dusts and fibers.
Okay, break that down for us.
This involves a combination of engineering controls, protective measures, and education.
Engineering controls.
Think about things like ventilation systems that remove dust from the air in workplaces,
Okay.
or using wet cutting techniques instead of dry cutting when working with materials that generate dust.
So it's about designing workplaces with worker safety in mind.
Right, and then there are protective measures.
Like what?
Like respirators.
Respirators, those are
that workers can wear to prevent inhaling those harmful particles.
like masks.
Exactly. They create a barrier between the worker and the hazardous air.
But specifically designed to filter out dust and other fine particles.
Right.
But both engineering controls and protective measures are only effective if people actually use them.
That's where education comes in.
Education.
Workers need to understand the risks associated with their jobs.
And how to protect themselves.
They need to know why wearing a respirator is so important.
Even if it's uncomfortable or inconvenient?
Right. It's about empowering workers to protect their own health.
Absolutely. And it's not just about individual workers.
Employers have a huge responsibility to provide a safe work environment, enforce safety regulations, and offer regular health screenings for their employees.
It's a shared responsibility.
A collaborative effort to keep workers safe.
We need everyone working together.
Employers, employees, healthcare providers,
And even policymakers.
to make a real dent in these preventable diseases.
This has been a fascinating deep dive into pneumoconiosis,
As we wrap things up, what are some key takeaways our listeners
especially those prepping for the MCCQE.
should keep in mind?
I'd say there are 3 major points to remember.
First, know your pneumoconiosis types: asbestosis, silicosis, and coworkers pneumoconiosis.
Each has its own quirks.
But they all share that common thread of inflammation and fibrosis.
It's all about knowing the specifics.
Second, prevention is key.
Minimizing exposure to those harmful dusts and fibers is the most effective way to protect workers.
And that requires a joint effort from everyone involved.
It's easier to prevent these diseases than to treat them. So let's focus on keeping people healthy in the first place.
Couldn't agree more. And third, remember that while there's no cure for pneumoconiosis,
Early detection and management can make a world of difference in a patient's life.
we have the tools to help people live more comfortably and maintain their quality of life, even with this diagnosis.
Be proactive, be informed, and be an advocate for your patient's health.
Solid advice.
And for those of you prepping for the MCCQE,
we encourage you to dive deeper into the StatPearl source.
It's a treasure trove of information that can help you ace those exam questions.
Now, before we sign off, I have a question for our listener.
All right, hit us with it.
We've talked a lot about the importance of prevention.
But what are some innovative strategies we can implement to better protect workers from occupational lung diseases in the future? That's a great question to leave our listeners with.
It's a challenge that requires creative thinking and collaboration.
But the potential impact is enormous.
We need to think outside the box and find new ways to eliminate or minimize exposure to these harmful substances.
It's about pushing the boundaries of what's possible and creating a safer future for workers in all industries.
Well said. That's all the time we have for today's deep dive into pneumoconiosis.
We hope you found it informative and, dare I say, a little bit exciting.
Remember, this is just the first in our series of deep dives designed to help you conquer the MCCQE exam.
Stay tuned for more episodes coming your way.
Until next time, keep those brains firing and best of luck on your medical journeys.
Goodbye, everyone. It strikes me how crucial it is for us as future doctors
to be incredibly thorough when taking patient histories,
especially when we suspect pneumoconiosis.
You're absolutely right. A detailed occupational history can be like a map,
leading us
straight to the root of the problem.
Because remember, those tiny inhaled particles can take years, even decades,
to cause noticeable symptoms.
Yeah, it's almost like detective work.
It is.
Piecing together clues from someone's past to understand their present health.
Precisely, we need to know everything.
Right.
The types of jobs they've had, the materials they've worked with.
How long they were exposed.
What kind of safety measures were in place.
It's all relevant.
It's amazing how a simple question like, what kind of work do you do, can unlock so much information about someone's health risks.
And it's not just about their current job. We need to dig into their past work history, too.
Someone could have been exposed to asbestos in their 20s.
But not develop asbestosis until their 50s or 60s.
Exactly. And if we don't ask about their past,
we might miss a crucial piece of the puzzle.
Right.
So we're not just doctors, we're historians, too.
Uncovering those hidden chapters in someone's life that might be impacting their health today.
And don't forget about hobbies.
Oh, that's right.
Some hobbies, like pottery or woodworking,
can also involve exposure to dust and fibers.
Wow, I hadn't even considered that.
It really highlights how important it is to be aware of potential environmental risks in all aspects of our lives.
Not just in the workplace.
Absolutely. Once we have a clear picture of their exposure history,
then we can move on to the physical exam.
And order those diagnostic tests.
Like imaging studies and lung function tests.
Right. Those tests can help confirm our suspicions and give us a better understanding of the extent of the lung damage.
And in some cases, a biopsy might be necessary.
To get a definitive diagnosis.
But it all starts with that detailed history.
It's the foundation upon which we build our diagnosis and treatment plan.
So taking a thorough occupational history is essential.
Especially when we're dealing with potential cases of pneumoconiosis.
It could be the key to unlocking the mystery of their symptoms.
Absolutely.
Well, I think we've covered a lot of ground today.
Pneumoconiosis is a serious but often overlooked health issue.
As future physicians,
you have a responsibility to be knowledgeable about these diseases, advocate for prevention measures, and provide compassionate care for those affected.
A detailed occupational history is crucial.
And early detection and management can make a real difference in someone's life.
Well, this deep dive is just the beginning.
We encourage you to explore the StatPearl source in more detail and keep learning.
The more you know, the better equipped you'll be to care for your patients.
That's a wrap for today's episode of The Deep Dive.
Thanks for joining us.
Until next time, stay curious and best of luck with your studies.